Well, thank you everybody for attending the data visualization panel. I think this is a really hot topic, as many of you are aware, and so I think you'll get a lot out of today's discussion. We have three excellent panelists who will introduce themselves in a few minutes. I first just want to start off with the definition of data visualization. What is data visualization? And we were just talking about this in the break room, that I get asked this all the time when I'm out talking to clients and prospects. You know, when I start talking about data visualization, the first question is, well, what's your definition of data visualization? And there's multiple definitions out there in the market, and none of them are really wrong, right? So it just depends how you want it worded, how you want to emphasize certain parts of data visualization. But I offer this definition that you might be able to take home with you. It's really around using graphical techniques to help you uncover trends or to communicate findings in your data more effectively. Simply put, that's what I think data visualization is all about. And why is it so important? As you know, we're uncovering, we're tracking, we're recording, we're storing tons of more data than we ever have before. And so we need new techniques, data visualization techniques, to start to really understand our data better, find trends, discover things in our data, and then communicate out the things that we find. Data visualization can help us navigate through this path. So that's what I think data visualization is. I'm sure you all have different views of that definition. You can go out to the internet and Google and find out other definitions as well, but this is the one that I tend to use and when people ask me, what's your definition of data visualization? All right, let's get on with the panel. I've got three excellent panelists, and I've asked them to give a brief introduction of their background and who they are. Andy?
Sure. Hey, everyone. I'm Andy Krackov. I work at Velir Studios, V-E-L-I-R. We do a lot of work in the data visualization space, data storytelling, data communication. A lot of it happens to be in healthcare. So we work like the American Heart Association, the Commonwealth Fund, the World Health Organization, AARP, and others who want to use their data and leverage data to communicate. Before that, I worked in philanthropy, actually, including at the California Healthcare Foundation, where I did a lot of work managing the open data initiative that foundation had put forward.
Good. Welcome, everyone. I know we're standing between lunch, so we'll try and keep this going. I'm actually Dipti. I'm the Chief Data and Analytics Officer of Vituity. I like to be known more as a Chief Data Storyteller. And for folks who have worked in data would understand that the part of understanding data is to try and actually tell a story through data. What is Vituity? Some people may know Vituity as CEP America. We actually are the largest physician-owned partnership. So we have about 4,500 clinicians who completely own the company. And we staff about 16 different specialties in the acute care spectrum and are in about 15 to 16 states. Yes, sure.
Good morning. My name is Dan Exley. I'm the founder of Exley Informatics. We're a small consultancy that's helping companies ranging from global Fortune 500 through to startups that are literally still working at a whiteboard, working on their MVP. I've worked in healthcare my entire life, healthcare IT, the bulk of that. Around 2002 was on the leadership team of the first ever enterprise-wide Epic install at North Shore University Health System in Chicago. Was there for a number of years as we quickly implemented and got to the meat of getting the second and third order benefits from that technology, and analytics is a big part of that. For the last decade, I was here in Southern California working for Memorial Care Health System as the Vice President of Data Strategy and Analytics. So working at scales both large and small, and visualization is a big part of how we get that final mile of information to the person who needs to action on it. So I'm excited to talk about that with the panelists and with you all this morning.
Great. The next thing we'd like to do, it's tough to talk about data visualization without showing some examples. So each of our 3 panelists will take you through some slides of some examples and their thoughts on data visualization.
Good. And these, the slides were on the right? Yep. Oh, good. All righty. So before I start showing some things, I want to ask folks a question. So say I were to ask you, which I will now, I've got some data I want to share with you. Would you like me to share it with you as an Excel file, or would you like me to share it with you as some summary graphs? Just to show of hands, how many people would say, yeah, please send me the Excel file? I actually thought there'd be more. I'm seeing no hands. 1 hand, 2 hand, a couple hands. Okay, and I'm 3 hands. And I'm guessing the rest, show of hands, would be the graphs? What, I should have said you can't choose both, but someone wants both. Okay. But yeah, okay, so just to situate ourselves, you know, data visualization, like Mark said, you can come up with many different definitions of it. What I take from it in this definition is this goal to try to make the data easier to digest and the goal to make it actionable in some way or another. That to me is the key point about data visualization. I'm gonna start off by just sharing with you how data visualization, healthcare data visualization, is being used. It's sort of part of the common vernacular. You know, I think every day, probably, as we read the newspaper, from governments, from advocacy organizations, we're seeing a lot of data visualizations. And so my colleagues, they're going to be diving into the details about how these are being used in the healthcare sector. And I'm going to give you a little bit of insight into how these are being used elsewhere, the kinds of things that the general public may come across. What I list here are some of the ways or reasons that organizations, including some of the clients that we work with, want to create data visualizations. It's to raise awareness of issues. Sometimes it's to persuade on an important topic that matters to them. They want to achieve a policy objective, a budgetary objective, and data helps make that persuasive case. Sometimes you want to empower a community. You want to provide data to a community of users. You don't know exactly how they're going to use it, but data is a way to empower that community. So lots of different reasons. This isn't meant to be an exhaustive list, but that gives you sort of a grasp of the kinds of things that one would want to do with data visualization. That's more broad than just within the healthcare sector, the care setting. So I'm going to start off by sharing with you a few examples that are, out there in the wild, so to speak, of data visualization. And the goal here is to try and give you a sense of the types of data visualizations that are out there. And the first one I want to speak to is this notion of data storytelling. We're hearing a lot about it these days. It's a common word. In this case, what we're seeing is this notion that data is being presented in sort of a question and answer context. The idea with this one is you sort of scroll through the document, it asks you questions, and as you're scrolling through it, it's answering the questions via visualizations. To me, data storytelling includes this. It's like providing the contextual information. It's about painting the data on a broader canvas, kind of like the heart and the head. The head being the data, the heart being poignant quotes, photos, videos. I think we have thought historically that the two should be siloed from each other. There's data and there's storytelling. And I think what we're learning now is actually when you can bridge the two, when you can combine the two, you can achieve a lot more impact. And this is an example of that. The next one I want to share, this is one that my organization Velir did for the Commonwealth Fund, and it's an example of a custom interactive. And by that, it's basically inviting the user to do something, to dive in and do something, to participate in some way. It's not meant to be just a passive thing that you view. In this particular case, we're looking at healthcare, quality of healthcare, compared to sort of spending, just looking at it particularly with Medicare. By healthcare referral region, obviously you can see where the poor performing regions are, But in this instance, the user can dive in and say, you know what, I want to compare Orange County, say, with Louisiana, or a section of Louisiana. It's inviting the user to do something, and from that, hopefully, take away the information that they need. So a custom interactive is another way of, providing a data visualization. This is yet another way. I like to think of this as like a query tool. Very popular these days. So imagine the scenario where you've got tons of measures. It could be on, in this case, it's this is a website we do on child well-being in California, kidsdata.org. And you have, let's say, lots of measures: child poverty, child reading proficiency, cancer rates, as this one is showing. And basically what you're saying to the user is, have at it. We want to give you the capacity to create your own graphs and maps. You choose what you want to create. You choose the breakdowns that you want. You choose the level of granularity that you want. That's a data query tool, and they're very popular these days, especially in the foundation space, in the philanthropic sector. So another example. I kind of think of this as the all-you-can-eat, sort of the Costco model of data visualization, and it can be very effective. Historically, I think, or at least as I've seen it, those of us that work in the data visualization space think of infographics. This is another type of data visualization. We're sort of dismissive of it, as if it's sort of dumbing down the data. And in many ways, an infographic like this I mentioned I worked at the California Healthcare Foundation. This is one that we had created 3 or 4 years ago. We think, well, gosh, it's dumbing down the data and it's creating this simple illustration of the data. However, I got to tell you that this particular visualization was one of the most popular ones that we had done when it was released. Very effective. I heard a lot from, say, county supervisors who said that visualization made a difference in our county. So it can be done effectively, and I think it's definitely worth considering that. 2 more that I want to share before I turn it over. These days, there's a growing notion, especially among newspapers and who have been really the leaders in data visualization, of turning data into games and intellectual exercises. And we tend to think that data, it's so serious. It shouldn't be a game. And in this case, the New York Times took the deadly serious topic of cause of death, looking particularly at drug overdoses. And what they wanted to do is turn that into a game. So this is a step above the custom interactive that I had mentioned earlier. In this case, you're actually asking the user to play a game with the hope that the information is going to stick. So what you do here for this is you actually sort of draw out what you think the trend is. They start with HIV, and then I think they move into gun deaths and car accidents, and then it ends with drug overdose deaths. And of course, as we all know, because of opioid epidemic, that trend line has grown considerably. And when I show that in public settings, you will hear audible gasps from people, like, oh my gosh, I didn't know the trend was that big. The act of actually drawing out the line rather than simply showing it, I think, is what makes this effective. And I think, turning data into a game, it could be a simple quiz. I think that can be an effective way to make data more engaging. And the last one I'll show is this notion that I think we shouldn't ever forget is the need to create simplicity with data and to understand how our users are going to be engaging with this content. It could, for example, be in the form of a presentation like this one, a presentation that you're delivering to your community and you want some sort of interactive way of showing it. We're hearing these days from a lot of our clients, whether it's at the local level, the national level, like those that work on Capitol Hill, or those that work internationally, like with health ministries around the world, about the need to present data as fact sheets, printable fact sheets. And the source of the data may be some sort of dynamic source, a big database of information, but in the end, what they want is a printable version that they can sit down with the decision maker and say, here's what we need to do. So we shouldn't lose sight of that, even as we get more digitally oriented. we still like to have messy desks in some ways with lots of paper. So, great.
Thanks, Andy. So I'm going to sort of piggyback on what Andy said in terms of Excel, because about 17 years ago or so, most of the data visualization was Excel. And I'm going to tell a little snippet of something that happened. And after I'm done, you can raise your hands to see if you had a similar experience. So I was actually a financial analyst. And I had one of my C-level folks come back from a meeting. And then he actually gave a sheet of paper to me, and it had 3D images. And he actually said, "It looks so pretty, the data has to be right." So I don't know if you've had that experience, but that was mine. And I was a data geek. I still am a data geek. I actually love data. So as I started to get thinking of folks who actually don't live in this data universe, actually want to be able to find the data pleasing, right? So I'll give you my example of data visualization. I look at data visualization as the bow, right? It's a gift box, you got a bow, you want to open it. So you open the box. Let me tell you, garbage in, garbage out. So if I put a little bit of coal in here, you're not going to be interested. Instead, if I put up car keys, you might be. So think about it from that perspective. I look at it in this way, that your framework, which is the infrastructure you use, the access controls, the data architecture you use is sort of the box. The algorithms and everything that you put in, which converts into a model that you're going to actually utilize, is the gift. How often do you go back and open the bow over and over again? Perfect visualization actually is when you don't think about the bow. You actually think about the gift that you got. So anybody who's in data, please remember this, that at the end of the day, what folks are going to remember is the action that they took. You really want to entice them to open and take the action. That's the goal of visualization. So I'll give a little example, because this is more than visualization, but hopefully, an image actually is worth 1,000 words, right? So when you create something, keep the user in mind, right? You can create something, but hey, the texting phone is really good, only if you have opposable thumbs. If you don't have it, don't bother creating something. So when we undertook our journey, for us, as I said, we are in the acute care spectrum, and our physicians who are in ED, hospital, ICU, anesthesiology, and so on, actually wanted tools such that when we as patients walk in the door, they can make some clinical decision support tools and have the information at the right time. So that was our journey. And how we thought about our journey actually was in these 5 buckets. I know a lot of thought goes into AI, machine learning, and we are big fans of that too. But at the same time, there is an importance in terms of reporting, in terms of utilization, in terms of being able to give insights of saying, here is what you need to be looking at. So that was our journey as we went, and this is a little bit more focused for us in terms of physicians. So as you go through, you'll look, I'll vouch for this. I'm good at data, I'm very poor at naming tools. So as you can tell, they're very descriptive, and our lawyer tells me very nicely that these cannot be trademarked. So we have other folks who are working on naming the tools here. But they're very self-explanatory, right? You need utilization, you wanna know patient needs prediction tool, you wanna be able to do operational monitoring, that's part of all of that. Clinical vigilance, what do I mean? I'm all the way to the right here. What do I mean when I say clinical vigilance? I'll give a perfect example. If you're in the hospital and have a high risk for falls, right? You want to be able to have somebody who addresses this risk. It's not at a patient at a time, right? So in our example, what we were building out, there was a person who got a report on paper, and I call her the fall risk czar. She would go room to room and literally was getting upset at the nurses saying, you're not doing what you're doing. We actually converted it into a tool that in a live feed actually tells you right here is a person who's going to be at risk and you need to do something before they are. So almost all of our tools are not after the fact. At the same time, we've got a lot of AI tools that actually give information. Everything is based on real time. So as the patient walks in, we're actually wanting to take in that information. So let me go through, I'll go through examples in each of the buckets because you'll see all the visualization is it's in the simplicity. I think Andy said it very nicely, right? If you have data, you want to put it simply so folks actually, and I'll pause here because we are all geeks in data and IT. I want people to know how smart I am. Who cares? They want to know the information they want to get. So get away from the part of what I call show up and throw up. So keep things simple that people can take, sorry, but that's my phrase of most of us want to, I know all of this information, you should know it too. A physician says, I don't really care, I just need to know what to do when I'm with the patient. So this is part of our utilization monitoring. You can see the filters, you can do pharmacy, you can do lab, you can go by, CT utilization. I mean, all of the parts that a physician needs to be able to see. For us, our most important is for them to know, what is the impact going to be by disease condition, by a patient age. So a lot of the thought goes in behind. As I said, it's inside the box rather than in the visualization. As I said, here is a patient needs. Nothing fancy in this, right? But at a list level on a tracker board in an emergency department, you want actually a physician or a nurse to be able to quickly see and say, hey, these are the patients I need to do something with. Our next one, this is our operational. We actually monitor, the number of beds, the throughput times, what it takes. So for us, we're doing by unit. We're actually looking how things go, which actually you'll see in the next one, right? So you do capacity metrics. What does my flow look like? Where are things headed? So in this one sort of snapshot, it gives you information, but color coding helps you say, hey, pay attention here. And then you can drill down and actually go through, more detail in terms of the metrics. I'm going to fly through the slides because, much as you're interested, I think having an interactive conversation is much more important. So here is something that for us is critical as we manage surges. So anybody who doesn't know, we had a flu season. So let's just be honest and say, for us, where we staff our physicians in the hospitals, in the ED, we needed to know at least 24 hours in advance that we needed to have physicians and nurses staffing. So we do a lot of predictive modeling in terms of surges that we have. This is our clinical vigilance. Really, again, very simple in terms of somebody having a real-time tool in their hands. As I said, this was sort of an example. If you were looking at a fall risk, be able to quickly see who are the patients you need to be paying attention to. And this is part of where we've actually headed because a lot of the visualization tools are one way. Right? For our physicians, if I'm giving them information and it's incorrect, they want to be able to give it back in real time and say, hey, this is not it or something else. I really need to send this patient into ICU. So we've actually created a bidirectional, and it's a mobile. So on their phones with a drop-down, they can actually choose, put feedback, and then it populates a dashboard. So those are our set of tools.
Thank you. Excuse me, I've been fighting something the last couple of days here, but as I was planning my remarks, I came across this lovely multi-dimensional, multicolored pie chart. Everybody's favorite chart type, right, is the pie chart. What makes up a successful TED Talk, a winning TED Talk? Almost half is a contrarian thesis, and only 1% is a sophisticated visual aid. I thought that was just kind of funny. Part of my thesis is that, as Dipti was mentioning a moment ago, we should be putting much more effort into the data models themselves and building trust around actionable information than we spend building the perfect bow. It's much more important about what's the package, the payload, and what's going to happen as a result. And as we look at how, and was mentioned before, there's many examples of how journalism has been leading the way, and sports is a big part of that. There was a phenomenal one that just came across after I submitted these decks. There's another interactive one looking at how income levels and socioeconomic factors are impacting outcomes and health and wellness. And it was another one where it was compelling, it was actually animated and moving, and invited you to interact with it and learn as you go. And that was the point of, journalism is trying to tell that story and convey a message and spur some sort of action or increase knowledge. So if we have that in our minds as we're going forward, there's still millions of charts made in Excel every single day. It's probably the world's most popular, widely used visualization tool, and I don't think that we should have a problem with that per se. We all have reservations about Excel as a tool, though, back to the previous point, because so often we get a chart out of Excel dropped into a PowerPoint, and I don't know how to trust the provenance of that data. What was the source from? Did you mess up that calculation? How can I see? So the problem is maybe not with the visualizations, although we've seen, all of us have seen an example of picked the wrong chart type, I don't know what you're talking about, and also I'm not sure you do either. Or maybe you're very effective at knowing the data, but didn't do a good job of selecting how to communicate that visually. We can go on at length about how to pick the right chart type, and sometimes a pie chart can be very effective for a small number of groups, and other times the sort of sunburst wheel within a wheel with dynamic labelings in a printed form may be overkill. However, think about, and I don't know how many of you have ever seen a sunburst chart type in action before. This can be very effective if they are live. So if I'm viewing it on a web portal and it's sitting on top of the native data set and I can see there's this cluster of a whole bunch of tiny volume data sets down in the bottom here. I can't even see the labels or know what it is, but I can kind of click and drag and drop and lasso that section and drill down into it. That may be an effective tool still, but you have to, again, think about the modality, and we have conversations about that amongst my team members. How is the user likely to be seeing this live connected to a data source? If so, maybe that's the right chart type to pick from. If you know that they're going to be flat filing it out as a PDF or only looking at it in print because that executive always has their assistant print out their deck and have it waiting on their desk when they show up in the morning, we need to think differently. So audience, being aware of our audience, as was mentioned before, being a huge part of this, in addition to picking the right chart type. There are some compelling standardized chart types that were maybe more advanced a few years ago that can communicate complex data by reducing it into an understandable multidimensional analysis. So this is a Marimekko chart. When does a Mekko become a heat map? Or a tree map? The answer is sort of, it depends. But there are some ways to show, the ratios within a data set. In this instance, this was showing the distribution across a data set of care that was delivered in a hospital, care was delivered in physician offices, and it was showing how that was broken out by the different type of insurance carriers that these patients have. So you can see total care is along this axis, and then total payer mix is along the x-axis. But then it's also animated, so the user can push play, and as it's playing along, in the background there's yet another metric. This 2010 is the year that this data applied to, and as that animation moves forward, you would see the different years troll by. So we can go to pretty sophisticated visualizations that are interactive, and those tools are sort of readily available and even being included in Excel in some extents right now. Tools like the Sankey chart type to help us understand flow. How many of us as an organization are looking at business process flow or patient flow, and it's really challenging to look at the big spreadsheet that comes out, which has the audit trail of every action, every step in a patient's journey. So we can use those chart types now to help us get a sense of where to go. I will say that, though, again, the more that we can connect these or any visualizations to our end users, to the actual source data itself, the more effective that will tend to be. But that's not global. A little tag, if you're not doing something within your organization to purposefully foster concepts of data literacy, and I would argue that data visualization and knowing how to pick the right chart type for the right use case, and there's you can Google some decision trees that help you figure out what are you trying to do, present relationships between data or data changing over time. to guide folks to pick the right chart type for the right message that they're trying to convey. But if you're not doing something even more broadly to educate physicians, caregivers, executives about how to think rightly about working with data and how to use data to drive decision in their areas of responsibility, then you're probably missing an opportunity. And it takes some work for us to carve out the time and figure out how do we communicate about that. And it's sort of can be paired alongside of if you're deploying a new tool, a new BI tool or visualization widget. As you're doing that, not just teaching people, here's how to change the date ranges and run an animation, but talking with them about how they can use this in a better way to drive decision making. That building literacy of how to use data as a part of our daily lives is a big opportunity for organizations. But sometimes simple is just right. So I would say some of these are very effective. If you're familiar with the notion of 3 feet, 30 seconds, I walk past a wall or I see a chart on a screen, I should be able to stand 3 feet away and within 30 seconds know everything that I'm supposed to know about that performance dashboard, for example. These are very low-fi, right? Maybe they're hand-plotted in some instances. This one's some work where we're showing a standard process that they mapped. Here's a daily control board that they were using in a manufacturing facility. But that team knew how to use it, it was actionable, and it worked for that use case. And it was also very inexpensive. Now, it doesn't help if they need to roll that data up into headquarters every shift or every day, and then you've got a different problem set to solve for. But all that to say, we don't need to be dismissive of the simple approach. Again, going back to what's the audience and the outcomes that we're searching for. One final example, and back to this notion of the power of having a live data set. This was a solution we built for a team of researchers. They were looking to recruit a panel of something less than 100 patients, but it was a pretty aggressive selection criteria. It was cardiac patients. They had a whole raft of criteria. You needed to have had a certain type of surgery in the past. You had to have some certain family history. You have to also be taking one of these 10 medications. A whole bunch of lab values had to be in certain ranges. So really difficult selection criteria. And the way you typically do that as an organization, if you don't have a more advanced solution, is you pay a nurse or another investigator to sit down and do manual chart review. Even if they've been live on Epic for a decade, they don't have much else at their disposal. You can get a report for that, but it's still often not that precise. In this instance, we provided, we programmed a data model that filtered that down, but then instead of asking them, which visualizations do you want to help you do the selection that you need, we were able to use a more dynamic tool and give them access. So, in 2 seconds, they run the report, 4 seconds, it pulls up the 6,300 patients and the 2 million patients data set. That's the present. They don't have to go look anymore for 6,300 patients. And they have a variety of visualizations they can choose from. They can see them by age or by who's their doctor or by where do they live. And they got to choose how did they want to look at the data from a subset of available options. But the value there, again, wasn't the visualization, interactive and powerful as it was. The value was there in the data being available for them to action and go do, reach out to that provider, provide that opportunity for that individual to subscribe to or join the clinical trial. So I think final thoughts I'd share with you before we get to the conversation is, number one, think about what your organization is doing to make your information, your data, available for analysis broadly. The era of big data has resulted in technology being available that can solve big data size problems. Almost every healthcare organization does not actually have big data in terms of the way that big data knows how to deal with big data. The technology does. Even for an organization that's got all the digital imaging and the PACS and transcription interfaces and all that, we're still talking about maybe terabytes to petabytes worth of data, and that's like a day's log file for a Facebook log, which is what the Hadoop systems were built to handle and more. So for us, it's an issue of prioritizing where we spend our time. And it's not even as much the money anymore. Like, that's not a technical problem. It's do we want to go solve this problem? Do we want to make our information available? And anybody sitting in this room, all of your data could fit in an appliance somewhere and be cataloged and ready for exploration. And if you tie back to visualization, the visualization tools can allow you to empower folks to go do something with that data. And if they come to a conclusion, somebody sitting right on the other side of the organization can go look at the same thing and basically show their math. They can get down into that. The technology has the horsepower to go do it. We don't have to batch things overnight or spend weeks building the perfect data model. And the interactive data exploration side of visualization can drive that. food for thought there is that, of course, we care about privileging and security around this. The good news is those tools support that as well. So turn on all the audit trails, log every click, look at every query and all of the contents of every query. We can do that now. 5-10 years ago, you had to choose. Either you could have a query execute in a timely fashion in a second or two, or you could audit it. Now both are the case. So we can satisfy compliance and security concerns within healthcare for very sensitive data. And then in pairing with that, you have applications within your organization, whether it's HR or finance or the electronic medical record system, which have an audited, I presume, security privileging and permissioning process. You can leverage that within your analytics stack to automate figuring out who should be able to see what. So you can take the EMR's security privileging, tie that in with the analytics stack, and when that user comes in, whatever they're allowed to see in the EMR or whatever allowed to see in the ERP, those can be inherited permissions, so the analytics team doesn't have to be burdened with figuring out who should be able to see what. I've done some compelling work with some of my clients in that regard, and it really shortens the time to value because we can just basically reuse an audited privileging process, inherit all of that, and that was relatively groundbreaking for a few of our clients. And don't forget the power of things like Coursera or any of those other free learning systems out there, like Lynda, for example, which you have to pay a little bit for, but these are learnable skills, so you can just tell everybody, hey, here's 2 free 2-hour courses. If you want to learn about fancy chart types, go take a look at these. They're endorsed by us to go take a few minutes to use, and people can build that skill, but oftentimes people don't know where to go. If you go Google it, they need a little bit of help, and you can help them by endorsing them to go in a particular direction.
Hello. Excellent knowledge sharing by all 3 of you. Some questions I'd like to ask the 3 of you as we move forward. The first one that comes to mind is, how do you take visualizations? I know Dan showed some examples, and Dipti too, but can you expand on how you would take visualizations and build them into the workflow to impact change? So,
we've certainly been hammering home this point, but it's just so important to start by understanding how your end users are going to be engaging with that information. I remember at one point we were building, when I was at the California Healthcare Foundation, we were building report cards on opioid abuse and misuse for counties in California. And they were digital report cards with tons of great information in them, lots of data from the California Department of Public Health. And then I remember showing a report card to someone in Mendocino County, and she said, well, this kind of display is not going to work for me. I'm presenting this to the Board of Supervisors. I'm going to community meetings and presenting this information. And this thing that I got to scroll through is not what is useful to me. I need something that feels like a presentation. And unless she had mentioned that, unless we had gone out and asked about that, it wouldn't have appeared that way. We wouldn't have been able to achieve that. So understanding your users' needs, walking in their shoes, doing the design thinking, I think is central to beginning the workflow work.
Absolutely. Andy, you're absolutely correct. I think I'll give the example because most of us have had an emergency department visit. We also live in California, or I'm assuming most of the folks here do. That a lot of folks who come in need some help, and they are a captive audience when they're in the ED. And after they're gone, sometimes they've used a burner phone, or sometimes there's not a location. So I think part of what we actually went through and looked at in terms of the workflow is exactly like what Andy was talking about, right? We asked the physicians, we asked the nurses, what's the best thing that we can give you in the moment? And so most of our tools, as I was even talking about earlier, looks at the process on how they would use it. So I'll use even a simple example because we do have a lot of mobile dashboards that we push to our physicians, and they actually have an auto notification. So now if you're a physician, you have notification fatigue, right? Because everything is getting notified. So what we've tried to do is actually match by your schedule and match by your patient. So, we get the information in terms of making sure that you're only getting notified when we need you to take an action. And that action actually may truly be, that this person needs psych help, right? Or this person needs some, social intervention. So all of and the way we talk about it is in healthcare, and maybe this is something, that we've coined. It's actually information friction. So what happens is, and the most studied or published example is actually the admission model. I don't know if you've ever seen, right? When a patient comes in, I'm able to predict at this accuracy that the patient will be admitted. You don't need a model. Within 2 minutes of an ED physician seeing the patient, they actually know to 90% accuracy that they're actually going to admit or not admit. But we spend a lot of time building out models, right? So what we did was change the workflow process, which is what are the things that you may need to make that in 99%? Or what are the things that you would want to have happen once you figured out that this person will be admitted? Because the goal for all of us is to make that traumatic experience of going into the ED a lot more easier and transition of care that much better.
It occurs to me that the notion I mentioned a minute ago about leveraging the security that we have, we care so much about security, and rightfully so, but as a part of that, we have these variables. I know who this user is when they're coming to an interactive tool. And passing that along has some work we were doing last year was pre-populating or the way that the data as the session was loading, as the chart was loading, taking in, we know what type of a user you are, you're a physician, you have a particular specialty. If we were loading from within a patient's chart or the provider's list of admitted inpatients today, those could all be passed through so that we're showing more of that, an effective visualization or any analytics is timely, trusted, and actionable. And so if we can save you 6 clicks and really show you the things you would most likely want to be getting at, that's another way that really helps to drive it into workflow so that maybe no clicks are required. I've seen some very powerful visualizations which are a visualization type of numeric point, which is just a little block of numbers, like on an infographic, there's a component that says 53%. And if that's the thing that that doctor is looking for right then, when they walk into the ICU and they're they're a pulmonologist, and the 3 vital signs out of 100 that are available for an ICU patient are the ones that are in large print above the patient's headboard and it's just black text on a white background, that's a tremendously effective and valued by the clinician data visualization. Tell me something I didn't already know so I can know what to do next. So again, back to that thought of the relevancy to the end user and also sort of being able to be live on top of the relevant hot data.
Next question for you. Let's say I'm in an organization and I know that we could really use data visualization to help us with some of our decisioning or workflow or discovery. Where do I start? What do I do? Where do I begin?
Well, I think what Dan pointed out is really important, that part of it is about the tool, but part of it is about learning, teaching people to fish in terms of building effective visualizations, There are instances when a pie graph is good. There are more instances probably, as we were pointing out earlier, when a pie graph is actually going to be unhelpful to your needs. By the way, as a small aside, some of that has to do with the brain actually has a hard time cognitively processing a lot of slices of pie, of a pie graph. And also if you're trying to compare multiple pies, there too, a stacked bar chart's a better option. But learning that and other kinds of things, yeah, you can do that on the internet. There are courses that can teach you that. So I think that's part of it. It also, I think, is really important to know the tools that you can use for this. Dipti and I were having an interesting conversation earlier before the panel started. And so a lot of the people that I work with are more like on the communication side. They're, or nonprofits, for example, too. They're not data pros. And for them, learning something like Tableau is a steep mountain to climb. And so I recommend for them much easier to use tools. And there are a lot of these kinds of tools out there in the work that I do, things like Data Wrapper, Infogram, Live Stories. These are the kinds of tools that people might turn to. They're not as powerful as Tableau, but they're easy to create something from. So I think it's a combination of the tools and the skills. And there may even be occasions when you need some coaching, that lesson, is that you learn online is not all that you need. And there are a lot of people out there who have expertise, not just with data visualization, but data storytelling, and can give you some good guidance and say, you know what, you should put a quote there. A poignant quote's really gonna help make a difference for that one. And sure enough, you might find, wow, that actually did make a difference. So.
Perfect. This is very cool because I'm going to give another analogy. Standing and weighing yourself on a weighing machine doesn't help you lose weight. So in the same way, buying a Tableau license actually doesn't make you a data visualization person. And I've seen that happen, by the way. And where do you start, right? The key questions, and I'm going to answer in a slightly different way. Know your audience. Who is going to be the person? Know the process. And then find a business relevant solution that you can deliver in no more than 90 days. And I'll tell you why. The minute it becomes more than 90 days, people have moved on to another problem. Because in all of our organizations, problems are plenty. And if you want to catch, the stakeholder or somebody who's actually going to say, hey, that's a great thing so that you actually get more jobs to do, you need to deliver in the 90 days. So I'd say, know your audience, who's going to use, because you've got to figure out that they will eventually use it. And you will, I guarantee you that if you're going to do this, you're going to fail a couple times. Turn it into an opportunity, right? Because if you're going to give somebody a tool and if they don't like it, they're not using it. And so no workflow process will be changed in that fashion. So know the process, know the business impact, and 90 days.
I'd endorse both of those perspectives, and I'd just add there are likely resources within your organization that you're not tapping to help with these problem sets. So there's maybe somebody in the marketing department who does understand how to do some programming that your IT department, ironically, but our IT shops are typically not build-it shops, we're operate-it, configure-it shops in a lot of cases. Maybe it's in marketing where there's somebody who knows how to write some code in Java and can build you a compelling data visualization to help you tell a story to the board. Maybe over time they migrate into the analytics team, or maybe they just stay where they are. But there's maybe those skills exist, and maybe they've never applied them in this way, but you could help them do something fun and build a cool collaboration. The other is there's probably a school or university in your neighborhood that has students that are graduating that you might want to pull into your talent pipeline. You should be doing that in general anyway. But in this area in particular, too, there's an opportunity to have early careerists or interns just to come in. If you're like, I don't even know how we could even get somebody to sign off on buying one license of anything else, there still might be ways to find the hands and feet to do it over the course of this summer even, with some open source tools, and you can provision them a data set with no PHI or not even run them through the process. So evaluate those things that are close at hand or already in-house.